Hello, my name is Dr. Dwelvin Simmons, and I'm a radiation oncologist at the Orange Park Cancer Center. As a radiation oncologist, I treat many malignancies. Those can vary from head and neck cancers, to lung cancers, to breast cancers, to prostate cancer, GYN malignancies, as well as skin cancers. I'm a board-certified radiation oncologist, and I've practiced here in the Jacksonville area for the past 13 years. I've been a member of the Florida Radiation Oncology Group for the past 10 years. I chose the field of radiation oncology because of the many things that it offered as a physician with respect to interacting and dealing with patients. Cancer can be extremely devastating, not only for the patient, but also for families. As a radiation oncologist, you're given the opportunity not only to treat the patient, but you're also able to inform the patient. You're also able to talk to people about prevention as well as improvement of lifestyles that may indeed impact their overall survival with respect to their diagnosis of cancer. One of the most common diseases that we treat happens to be breast cancer. Women faced with the diagnosis of breast cancer are really given the opportunity of a mastectomy, which is the removal of the breast, versus breast conservation. Those patients that choose or elect to keep their breast are committed to a course of radiation oncology, either immediately or following a course of chemotherapy. Those patients that undergo whole breast radiotherapy will also receive something known as a boost to the tumor bed. This is a very important component of that treatment. It reduces the local recurrence in the tumor bed from about 10% without a boost to around 2% when a boost is given. With respect to this boost treatment, there are several ways in which that can be accomplished. Historically, we've used either an implant or we've used electrons or potentially tangential irradiation to accomplish this task. This has been very successful with respect to control of tumor in the lumpectomy cavity. However, in certain instances, women have been rendered less desirable cosmetic results. Over the past few years, what has been evaluated is ways in which the overall cosmesis of a boost procedure can be improved. Newer techniques for performing boost have evolved, and one of those is AccuBoost. When a patient's initially diagnosed with breast cancer, the mammograms and the needle localization define the tumor bed. When we perform the AccuBoost technique, we're obtaining those images in the exact same fashion and comparing the images obtained to the original mammographic images. That allows us to post-operatively locate the actual tumor bed. Once that tumor bed is located and correlated to the grid system of the AccuBoost system, we then will place this cylinder strategically over the center of that grid system, defining the tumor bed, and then initiate the treatment. The catheter of the cylinder is coupled to the catheter from the HDR unit, and from this unit travels an iridium-192 source down its catheter into the catheter of the cylinder, and then for the specified prescription, it dwells at certain positions in this center to deliver the actual dose of radiation. Once that treatment is completed, the patient is released from the mammography unit, and then the treatment from the medial to lateral projection is then initiated in essentially the exact same fashion. This actual treatment takes about 10 to 15 minutes to deliver in each projection, so it's completed in approximately 30 minutes. The patient then goes home and then returns the next day for their next session of their boost treatment. Traditionally, that component of the radiation occurs at the end of the course. However, with use of AccuBoost, the radiation boost is performed initially. The reason for this is following conventional external beam radiation, there can be areas of redness, soreness, and irritation about the breast. As everyone knows, mammography can be extremely uncomfortable. it can be extremely more uncomfortable after several weeks of radiation. So because the technique of AccuBoost involves the exact same procedures that are used for mammography, it is best that the boost be performed before these results of radiation with respect to skin irritation and soreness do occur. The use of the AccuBoost technique is becoming more and more widespread given the actual improved cosmetic results that have been seen using this particular technology. For more information regarding AccuBoost, please feel free to call the Orange Park Cancer Center at 904-276-2303. Thank you.